Good evening, guys. This tonight's discussion D is discussing um, GPS tracking for dementia. So we are going to dig into that tonight for D. So please join me for tonight's presentation D. GPS tracking for dementia care. Okay, here we go. The surrounding page situates or situates real-time location systems or RTLS as wearable devices, often resembling watches or bracelets used continuously in long-term care environments. Their stated purpose is safety, establishing staff enabling staff to quickly locate residents, preventing wandering, and respond to emergencies. Yet the page emphasizes that these devices extend into intimate spaces like bedrooms and bathrooms, collecting movement data around the clock while data marketed as innovations for nurse calls, contact, tracing, and reducing elopement risks. The evidence based for their effectiveness remains limited. What emerges is a tension between promised safety and lived experience of surveillance, where privacy and dignity and autonomy are at stake. Core ethical questions raised: autonomy versus safety. Continuous tracking can reduce risk of harm, but also erodes self determination when residents have no meaningful control over whether or when they are monitored. The page underscores that autonomy is not a luxury. It is central to dignity in dementia care. Informed consent and awareness. A poignant example is a resident who accepts a watch like device without realizing it logs every movement. This highlights the ethical gap between appearance and function, and the difficulty of securing genuine consent from cognitively vulnerable populations. Privacy and data governance. The page raises concerns about who owns the data, how long it is stored, and who can access it without clear governance. Tracking risks is becoming a tool of institutional governance rather than resident safety. Proportionally and necessity. Ethical evaluation requires asking whether continuous monitoring is truly necessary. This page questions whether the harms of surveillance are justified by demonstrable person-centered benefits given the lack of robust evidence. Who's most affected and often overlooked? Older adults living with dementia. They are the direct subjects of surveillance, often without full awareness, facing intrusions into private spaces and daily routines. Family caregivers. Their voices are often absent in research despite their role in negotiating trust, safety, and autonomy for loved ones. Frontline staff. RTLS can support care but also function as a tool for monitoring staff performance. Raising ethical questions about workplace surveillance. Practical safeguards emphasized by the page. Person-centered and purpose. Tracking should be tied to specific time-bound safety goals, e.g., preventing nighttime wandering, not imposed as a blanket measure. Regular reassessment ensures that benefits outweigh burdens. Transparent consent processes. Residents and families should receive plain language. Explanations of what data is collected, how it is used, and have opportunities to decline or pause participation. Data minimization and security. Only essential data should be collected with strict limits on access and retention. Secondary uses, such as monitoring staff, should require explicit separate consent. Respect for intimate spaces. Surveillance should not extend into bedrooms or beds unless narrowly justified. And even then, safeguards must be in place to protect dignity. Bottom line, the page cautions against uncritical adoption of RTLS in dementia care. While safety is a compelling narrative, the ethical cost, loss of privacy, autonomy, and dignity are profound. Responsible use requires more than technology deployment. It demands ongoing consent, proportional application, strong governance, and genuine inclusion of residents, families, and staff in decision making. In short, tracking with care means ensuring that technology serves people, not institutions, and that safety never comes at the expense of humanity. Guys, I understand that dementia needs monitoring for folks, but not at the expense of when it comes to their privacy. You can safely do that without having them tagged like tracking devices on their ankles, like bells on bells that go off when they go by the door, or different things of that nature. You also have to decide. You also have to realize that they're people too. They're not just residents, and they do have rights as residents also, even though they have dementia. They're still human beings. So humanely, you as places or caregivers have to realize that humanity comes first when you're dealing with a human being, because they start out with a small touch of dementia. It comes lightly first, mild to moderate, and then severe. In the mild form, they're still asking questions. When they have those good days, they're going to ask you what's going on. And your job as people taking care of them is to give them the straight answer. Don't sugarcoat it. They deserve a straight answer. Even though you have to repeat yourself, you still give them the same opportunities as regular folks in nursing homes. Not shut-ins. Don't shut them behind doors. They have rights to. Yes, you have to have secure spaces, but you still treat them like human beings, folks. So with that being said, that's tonight's shows. I'll be on tomorrow for shows. For now, Gator Wellness, take care, folks.